This again comes with the lack of education about the fact that these conditions existed for years, right? This endometriosis is not a new condition.
Right.
I remember a time we did a community outreach, and this woman, I am convinced she was probably in her 50s. She asked myself and my colleague, where were you all when I was getting my diagnosis like 20 years ago? I needed you all then.
Right.
Yeah, to like speak up for me.
Today we're talking about invisible pain and unspoken stigma, and we have a wonderful guest whose work really digs deep into topics that you can't see a lot of the times that people are living through and pushing through. And in our previous episode, we talked about strong Black women and some of the narratives that come with being strong, and sometimes some of the silences, some of the prolonged pain and suffering. And so Julia is going to talk to us about that. And we're going to ask Julia to introduce herself to our listeners and viewers.
Hi, thank you so much, Rasheeta and Rochelle. Really happy to be here. So yeah, I'm Julia Mandeville. I'm originally from Barbados, currently residing in the US, completing my PhD in public health. Prior to relocating, I was diagnosed with one of the invisible conditions I think we're going to get into today, endometriosis. And that kind of started this entire journey actually into researching what this meant for me as a Black woman and what that collectively means for the community of Black women that I started to engage with these conditions. So for those of you who don't know, Barbados is a tiny island in the Caribbean, home to Rihanna. It's small.
There you go. Tiny.
Yeah, very, very small, but big, and we do things big. I think we punch above our weight is what we like to say. And we're one of the most majority Black countries within the Caribbean. About 90% of our population is Black. And so when I was first diagnosed with my endo, I started to read things that said, this is typically not something that is found in Black women. And I found that odd because I'm a Black woman and most of the other people I was engaging with were Black women. So then that's when I realized I think there's a disconnect here between the lived reality of Black women with endometriosis and what the research is saying. And that kind of sent me down this path, led me to meet with Dr. Rochelle, and the rest is history in terms of that research aspect. But also prior to that, I co-founded an organization. So I also come to this from a space of advocacy when, again, I found out that there was not that many resources on island for women with these types of conditions. So endometriosis, uterine fibroids, which is very predominant in the Black community, polycystic ovary syndrome. And so with that organization, we do a lot of education, advocate for policy changes, advocate for guideline changes in terms of what is happening with clinicians and our particular population, and also partnering regionally and internationally with other majority women-led organizations, really trying to move the needle in terms of getting more care for Black women and other minoritized populations with these really underserved conditions. So I think that's a good synopsis of who I am.
Wow, you said a lot in a small window of time. I mean, I think it just, barely captures, I'm sure, the work that you put into it. So I'm gonna pivot I'm gonna go ahead and let Rochelle, because I feel like I cut you off. So go ahead, Rochelle.
No, I was agreeing with you, just saying like, yeah, there's, that's a quick synopsis of Julia's work. I mean, very dedicated human being to exposing this sort of invisible pain. So Julia, if you could take us to, we've talked about this, right? It's like, how do we get to the stigma? How do we get to this idea that people don't feel comfortable or don't feel supported talking about something particularly related to reproductive health, and I just think about the silencing around menstruation to begin with.
Yes.
Right.
Yes.
And I'm thinking about the young girls in my life who are just going through this passage, this rite of passage, and they're coming to me as an aunt, as an honorary aunt, like, you know, and I'm like, let's celebrate, you know, and they're looking at me like, but I'm trying to change the narrative because for me, I felt cursed every month, and I still work through that, right? Because it is, I experienced a lot of pain. And it was basically was like, well, this is just what happens, you know, there's nothing you can really do about it. So can you take us through like these, maybe, you know, the things that we hear growing up, because we try to center on the family as a site of intervention, as resistance to structural injustice, right? We want to talk to parents, we want to talk to, you know, the village about how we can do a better job about communicating about such things that have been silenced or stigmatized for generations.
Right. I think that's a good place to start, because for me, it's more with the menstrual stigma. I think it's because, again, like you said, historically, menstruation has been stigmatized. And again, not just in the Black community. I think there's so many cultures globally that do stigmatize menstruation. And personally, I don't understand it because it was never stigmatized in my immediate household. So I will say that. I was actually very excited to, like, when I was learning I was going to get my period. Like, I thought, you know, I'm becoming a woman, and then the pain hit, and I was like, oh, wait, not, be careful what you wish for. But then when, again, engaging with others, I recognize people, like, say, you know, my parents, especially my mother, would be like, that's no one else's business, you know, you don't have to tell anyone about that. You know, you would take like the pads or the tampons when you have to go change them and try to hide them discreetly in your pockets or somewhere so other people wouldn't know that you are having your period. And I think it comes with, again, just the knowledge that you're bleeding. And I think for me, I always found it weird because this is the only type of, from that I can recall, the only type of like bleeding that is so stigmatized. Like, you get a cut on your hand, you get a cut like on your head, and it's like, oh no, we need to fix that. But then when you're like bleeding, you know, from your reproductive organs, it's like, no, can't talk about that, don't want to hear about that, no one needs to know about that, that is your business, right? And I think that has been perpetuated in, again, like you said, in a lot of families. It's also a signal of, I guess, becoming a woman. And I think in some instances, it might be a protective mechanism because we don't want other people to know, like, this person is now ready to bear children. So I also can see it from that lens as well. And, you know, to maintain your childhood for as long as possible. But I think it does girls a disservice because you are, even if you're doing it as a protective approach, it can still unintentionally, again, add stigma and shame to what they're going through. Like, stigmatizing them becoming women is like, it's something to be ashamed about. And then you go into adulthood still carrying that shame, you know, not being able to communicate well with, you know, your other peers, your partners. And then, you know, that kind of continues. It's a cycle because then that isn't corrected. And then when, you know, those girls become mothers, then the cycle is perpetuated again and again and again and again. And so I think it's really important to have these conversations about how menstruation is normal, that blood is not dirty. And that's another thing. We use words like dirty versus clean, and that instinctively gives that stigma of something is wrong, right? I am like stained. And that, again, gives fear and anxiety a space to grow and, again, be perpetuated within family structures. So I think that is kind of where it comes from. It's complex, but I think deep down it's, again, the stigmatizing of the blood, and then also maybe wanting to maintain some semblance of innocence, but the conversation between that and then actually growing into adulthood doesn't really happen. And so the trauma from that type of action is still kind of there. So that's why I do the work that I do, to help kind of remove that stigma and normalize talking about periods. Because as you mentioned, Dr. DM, I'm going to say that a lot here, so if I'm not supposed to just let you know, but then if you are in pain, or if there's something that isn't wrong, then you don't know because you haven't had the conversation, so you haven't been given the information to recognize what is quote unquote normal versus what is not normal. And then you get into adulthood with either excruciating pain, which was what was happening with me, and then get a very late diagnosis, or you might not necessarily have pain, but you might be trying for a family and then be met with infertility. Right, because endometriosis is what I have, is a condition that is associated with infertility, and it's something that could have potentially been addressed with earlier intervention had conversations had happened for a young girl to know, okay, this is what normal menstruation looks like, and if there's something out of the ordinary, then we would need to seek professional services, professional advice, just to like figure out what is happening there so that we can intervene as early as possible. Yeah.
I think this, so I really appreciate that you have been motivated by some of the things that you've experienced to really try and defray that when it comes to others. And so I am, all of us are researchers and we enjoy that element of it. And we obviously feel like that has a place with helping to change the narrative a lot of times around some of these things. And I happened to pull up a report that I thought was extremely intriguing. It was by Massachusetts Health Quality Partners, and they did the work is entitled "A Patient-Centered Research Roadmap to Advance Equity in Endometriosis Care for Black Women." And I agree that it certainly is this hidden pain. And I think before I really jump into the research, I will also mention that when we talk about pain and the fact that it's not like that, external cut on the hand that people can see, and that you're expressing as a Black woman that I'm in pain, or I can't function or be whatever you want me to be to you at this time because I'm in pain. How has that been for you when you may not have been able to show up because of the pain that has been associated with your endometriosis, or that hidden disease process that people might be like, oh, she's just making excuses, everybody can work through some menstrual pain, you know what I'm saying?
Right.
You're not the only one who had a period.
Right. Yeah. No, thank you for that. It's been a roller coaster, honestly. So again, when I was first diagnosed, this was after about 10 years of experiencing the pain. And so I was growing up and thinking it was me, thinking I was cursed, right? And I have an older sister, and yeah, she had some discomfort, but it did not seem as though the pain she was experiencing, it was like nothing compared to what I was experiencing. And so I think those are wrongly thought I was exaggerating. I was still made to go to school, made to do made to do all of the things because everyone has a period, right? Everyone, every person who was assigned female at birth and has a uterus eventually will go through this. So again, what makes you so special? And that is actually something I keep hearing throughout the research I'm doing right now. Like you're everyone has this, like you're not anything special. And that's really harmful because again, you start to internalize that. Is like, well, if everyone has it, why are they able to manage and I am here struggling, like struggling? And then when I look back through my formative years, every time I did, so I'm an academic, and every time I did poorly academically, it was around my cycle. Every single time. It was because I couldn't concentrate. I was forcing to go and do these exams and do this work, and I just couldn't. There were some times when even if I didn't eat, it made no difference. It just wrecked my body. And then when I got my diagnosis, I started to change a little. I was an educator at first, and so I would still like force and go to school to teach. Or if I couldn't, I would do like a lot of makeup classes with my kids via Zoom. And this was before 2020. So via Zoom, and evening classes, morning classes, just to make sure I got them the information, because I felt so guilty. So I think I very much bought into the strong Black woman schema, in that I have to make it. I have to do it regardless of whatever is happening with me. But then I think, especially after I started delving into the research myself and recognizing not only the physical havoc that I was wreaking on my body, but also the mental like issues I was dealing with, I recognized that I needed to give myself grace and recognize that I didn't ask for endometriosis. I didn't cause this to come upon me. It's something that, I potentially was born with. And so it's just for me to recognize that that's what's happening and honor my body, give myself grace. And then also, I am very verbal about my diagnosis, and I let people know, so that when something does happen, I can explain, like, this is the situation. I'm having an endometriosis flare. I know it's not ideal. I know it doesn't work with our timing. I can apologize, and I will figure a way to make it up after. But at this point in time, I just need space to give my body grace and rest. And I know that I'm in a position of privilege to do that, because everyone can't do that either. I don't have kids of my own, but if for people that do have kids and have to navigate endometriosis, I've had friends that feel so guilty when they can't be there for their children, and it plays on their mind daily, as in, did I do the right thing, right, to have this child, knowing that I have this condition that can incapacitate me this often. And so it's always this tug of war between acknowledging what's happening with you physically, but then that psychosocial, a lot of internal stigma, I should say, in I should be able to manage this, I should be able to do better, and I still can't. So it's really a roller coaster for me, and I'm sure for a lot of people with these types of conditions.
Absolutely.
Yeah.
I mean, PMS in general is a roller coaster, right? But it's so stigmatized. And I think, like you said, there was so many really important things that you said, but I just want to go to the idea that, reproductive health issues are stigmatized if they don't lead to the outcome that has been identified as the outcome, which is a baby, right?
Yeah.
And so everything else is kind of a nuisance until the baby, right? So you get your period and you just got to keep at it until the baby, right? Or you deal with these other pains, and I'm like, this is just so. I think about the little girls that I interact with all the time, right? My daughter is 7, nieces is 11, and all these other little girls that are just like, we don't want to have kids.
I was gonna say that. I literally wrote that on my paper. I was talking to a colleague. She's like, I'm 45, and it's probably not going to happen. But her mom still said, well, are you thinking about adoption? So it's
there it is, Rasheeta. And we talk about this all the time, the difference in generation, right? So my young girls, right? So not just my daughter, but the little girls in my life who come to me and they're like, we don't want to have kids, Auntie Shelly. I'm like, you don't have to.
Right.
That is so far away from my grandmother and even my mom, right? And so I didn't feel pressure from my mom, but I think it's because I had them.
Yeah.
Right.
Because she didn't have time
exactly.
to say, hey, what's up, right?
Yeah.
I was having them. So she was, oh yay, she's a mom.
There was no pressure, but I think subconsciously, because I think for myself, subconsciously, 100%. I did still feel 100%. That it was like a thing, right?
100%. 100%.
It is. Yeah.
I do feel like so in other words, I don't even remember being able to vocalize to any older woman in my life that I don't want to have kids.
Right.
Whereas my daughter, my nieces, my goddaughters, my village daughters, they're so I promise you, the majority of these young women and little girls are like, no kids for me, right? And they're like, because they're thinking about their professional aspirations or just know, they see us and what it takes to be moms, and they're very in tune, and we're very vocal, right? I think before, our moms and our grandmothers would, maybe take the struggle in silence in their prayer closet, where we're like having coffee or wine and our kids are nearby, and we're like, yo, these damn kids, or this is a lot.
So I can't have no peace because I'm running from here to
they're hearing a different kind of messaging.
Ooh, Lord,
and I'm sure they'll be mad at us later, right? But
they'll be all right. They'll get over it. They say some things that I'm like, okay, side eyeing them on too.
That's right. That's right.
So it's mutual.
And that's exactly right. And so it's like, I wonder if, because of the way we're raising them, are we able to reduce the stigma in this way, right? Because if we're saying that getting your period is not about the end goal of a child, right? Getting your period is a part of life. And if your body is ovulating and going through the changes, and then this is what it is to have ovaries and a womb and reproductive organs in this way. This is what happens, right? So it's biology, it's science. It's not moral. In other words, it's not evil or good, right? And so the way that we talk about it gives them space to just be like, well, I'll deal with it, but I'm not gonna, end it by having a child. And I say that because I really remember talking to my gynae, right, when I was like 19, 20, and just having severe menstrual cramps every year since starting my period. And I was an athlete. And so they would say, oh, because you're an athlete, it should be less. Well, that wasn't the case for me. So they would say to me, I remember him saying to me, oh, just have a baby. You're going to see it disappear.
Yeah, because the regeneration of the line.
Because, just pregnancy is supposed to be a cure. Like,
and then it's like, do you know what comes on the outside, on the other side of that?
Right. I'm not equipped to have a baby,
And or they put you on different birth control meds and try to adjust your hormones. And there's so many things that you go through as a young woman that when I think of how, I don't think I felt shame, but I definitely felt frustrated with having, the pain related to menstruation. And I felt inconvenienced and bothered, right? Now, if it was diagnosed, and I didn't even end up getting a diagnosis. When my doctors look back now, they're like, Rochelle, you absolutely had endometriosis, or, and so this is just you wonder what has been normalized for us to endure.
Right.
And how do we change this? How do we, and I know there's a lot of work going on in the medical field, and I'm glad Rasheeta brought up that report, because there's so much pushback of saying we need to do a better job of when we're engaging, especially with Black women. If they're coming in for menstrual cramping, and, have you checked their cervix? Have you checked the lining? Have you checked other things that could be contributing to that level of pain? What have we done? Have we done our due diligence, right? So I'm grateful for scientists and scholars like you and many others that focus primarily on this issue, because so much of it has gone undetected, undiagnosed, made it to seem like, oh, this is just a part of being a daughter of Eve, right? Spiritual.
Right. Yep. It's because of our sins.
Yes.
It's because of our sins.
Yeah. And so, Julia, to bring it back to all of the great things Rochelle just mentioned, I mean, she just encapsulated so many of the things that I think you have emphasized in your intro, and then also just kind of the things that we really need to be thinking about moving forward with. How do we combat this and really create a space where it's not stigmatizing, or we're not silenced? And because I was thinking about the silencing when we talk about childbearing, when I think about some of my people in my age group now, sometimes they don't even say that they don't want to have children anymore. They just don't have them because they don't want to have those conversations, right? They don't want that pushback. So they haven't quite gotten as bold as some of the younger generation that says, like, I don't care what you say, I'm not having children. That's my, that's my decision to make. I'm finding that people in my age group are just not saying anything, and they just kind of feel like they've aged out of having children and just are feeling, they don't feel like they want to have the conversation. So I think, not to get too personal, but and certainly what you feel comfortable with, like, did childbearing, like, was there a fear when you realized or actually finally got a formal diagnosis of endometriosis around the issue of having children for you? And then I'll also just add, like, there are some really powerful quotes from this report that I would love to get your response to, but on the back. So I'll ask that question first, I'll kind of engage, and then I'll kind of play a little bit of a kind of call and response to you on those.
Yeah. Okay, no problem. So thank you for asking that. So for me, when I was first told that I may have endometriosis, because at this point in time, to really get that diagnosis, you have to have a surgery. It was presumptive, and I saw it, and I read about it, and I read about its impact on infertility. And at that time I had started my master's. So I was like, I'm not trying to have any kids right now. Like, I was like, that's not for me right now. And even after I came out, like, one of the first things the surgeon said to me when I opened my eyes, and he was explaining, it's not just endo, it's severe endo, and how it's just like kind of causing all of my organs to stick together, basically. Right, yeah. He was like, if you want to have kids, you should try now. I was like, no. Even then, I was like, no. Because I just started my master's, and I was like, I need to get through this, and I was working full time. So I was like, there's no way now. And then post-diagnosis and post-marriage treatment, like, I was married, so like the conversations were happening, and it was on and off. Like, my husband went and got like the testing and everything done because we were talking about it. But I think going back and forth, I love kids. So I want to preface it by saying I love kids. I taught for many years. I have children. I love them. But I never felt like that pressure that I have to have them, right? Even after my diagnosis, I think it was more so others' expectations of me. And then after I put that aside, along with, trying to give myself grace, dealing with this condition and knowing what it was doing to my body, it was like, I'm already dealing with so much. I need to give myself space. So I would say that for me, I personally don't see myself carrying biologically, and I'm fine with that. My husband's fine with that. He's always said, whatever happens, happens. It's, if it's to be, it will be. I think before my diagnosis, my parents were like putting pressure on me, but then post-diagnosis, that stopped completely. Like, our family does not put any pressure on us whatsoever. So I think we're very lucky in that way, because I know that is not the norm based on my interactions with others. And so when people do ask me, I said, like, we've made the choice not to actively like pursue IVF or anything like that right now, because I think at the end of the day, like, if it happens, it happens. And then more often than not, I also feel like called to more or less adopt post PhD, but I feel called to adopt. And so that is something I definitely will pursue more later down the road. But I think for me, I give myself grace. And I just would like for other people to give themselves grace. If they want to actively try, do it, but make sure that you're doing it for yourself, that you want to become a parent, that you want to become a mother, and not because of these external pressures, which I know are really hard. I know they're really, really hard. I will say, especially like in the Black community, I have spoken to a lot of people who feel guilty for not giving their parents grandchildren. And I know that's a very heavy load to bear, but I think to combat that, I think that's why we need to have more education about the fact that getting pregnant is actually not as easy as a lot of people think it is. Keeping a pregnancy is not as easy as a lot of people think it is. There's a lot of pregnancy loss. Like, let's not even, like, there's infertility, but there's also a lot of pregnancy loss that is not talked about, because that in itself is stigmatized. And so I think if we were able to pull the curtains back on all of these things that that we keep hidden and like say that this is the reality, I think that there would be a lot more understanding and a lot less of these heavy expectations on women to just, you know, carry a child without complaining and becoming a mother and, you know, just doing everything like if this is so easy. Because I, even though I'm not a mother, I know it's not easy. I've seen my friends, I've seen my aunts, I know it's not easy. So I think just more community education and awareness about really the difficulty in navigating these spaces, I think that will be very helpful. Yeah.
Can I ask a question about the disclosure when you realized when you were diagnosed? Did you tell your parents, like, what was that process like? And do you feel like they stopped asking you about pregnancy because of the disclosure of your diagnosis?
Yeah. So I will say I grew up in a family. So my dad was in the healthcare sector for a long time as in an administrative role. So he's not a clinician, but he's been around enough clinicians.
Right.
And so when I got my diagnosis, my mom was the person there with me during my surgery. And so she never heard about endometriosis yet. But with so they were there. I got the diagnosis. They were there. So it wasn't as though I got the diagnosis and then I had to go tell them. They were there during the surgical procedure. And then when I was doing my research and I was sharing with them more about it, especially through my advocacy, their thinking just came around naturally. There was no pushback. They actually, sometimes my dad would be like, are you supposed to be eating that with your endometriosis? Because like it's a condition that is inflammatory. So there's certain things that make, you know, your symptoms worse. So sometimes they're even more on it than I am. And so I think, like I said, I know I'm very lucky in that way. So it was not difficult whatsoever. Once they understood what it entailed, they were fine with supporting me with whatever I needed, however they could.
To extend that and kind of bring it back to some of the conversation you mentioned about in your earlier years and being made to continue to do school and things of that sort and push through. Did you find that your parents had any level of guilt that they expressed to you in any way by chance? Like, do you feel like they, you know, once they realized that you actually had a legitimate reason as to why you were having these symptoms, do you feel like they felt guilty in any way? I'm just curious.
I don't want to say they felt guilty because I did not ask them if they felt guilty. I think they were just shocked. I do think they were shocked because, again, my parents are on the older side. I have a sister that's 7 years older than me. So I think because they never heard of this condition, never knew that these things existed, I think it was more shock than anything else. And then, I mean, maybe a little guilt, just in recognizing that I was suffering. But again, it wasn't their fault in that they didn't know. And I think this again comes with the lack of education about the fact that these conditions existed for years, right? This endometriosis is not a new condition. I remember a time we did a community outreach, and this woman, I am convinced she was probably in her 50s. She asked myself and my colleague, where were you all when I was getting my diagnosis like 20 years ago? I needed you all then. To like speak up for me. So I think it was more shock and okay, so we got it wrong. She was actually not faking. It's time for us to just rally. And I will say that my parents historically have always been, if there's a health issue, we're gonna find any way to fix it. So that's why I don't want to say that they felt guilty per se, because they didn't know. Because if they did know, they would have acted immediately.
Absolutely.
Yeah.
So, and I appreciate that, because honestly, I think that what I was kind of doing some personal reflection this morning, and it really reminded me, just out of the blue, I was thinking about parenting, and it's like, we're not perfect parents, but we're present parents, right?
Yes.
We're present. And we don't get it right all the time. But I think that just I think you have kind of codified for me that it's like if you're present and you're trying as you mature and know that what it takes to be a parent, just even observationally, that you're like, well, they tried, right? They're not perfect people. And they really, would have done more had they known the severity of what you were experiencing.
Yeah. 100% agree. That's something I would say. My parents are, even now, very, very present parents. I live on my own in a whole different country, but they're going to ask the questions and try to make sure that I'm doing what I'm supposed to be doing when I'm supposed to be doing it. And if they need to help, they're there. So they're very present. Yeah.
Rasheeta, you said you had some quotes.
I do. I didn't want to hog the time, so
no.
Let me give her. I'm going to take a breath, so if she has something, she want to say. So I thought these quotes were really interesting, and it's really nice to hear. And these are Black women with endometriosis. Excuse me. And so I would love to hear kind of how you respond to theirs. This particular woman said, endometriosis is like a bad layer cake. You start with the bottom layer, which is access. If you don't have insurance, or your insurance is saying, no, you don't need that test, or you don't need that MRI, then how are you actually getting the care that you need? Then you add in all of the other layers around endometriosis, so much scar tissue everywhere within your body, causing all kinds of chronic pain. It's like a terrible cake that nobody wants to take a bite out of. So any visceral response to what was stated there?
I feel like that's one of the best analogies I've heard for it. Particularly when it says, no, you do not need that test, or you don't need that MRI. I will say, if we're looking at this from the lens of equity and social justice, that happens more often than not, honestly, with Black women and other women of color, right? That denial of care, that denial of service. There's this doctor, his name is Donald Chatham, who in the 70s, so he was a Black gynecologist in the South. I think he was in Georgia, and he re-evaluated 120 Black women who were complaining for pelvic pain, and they were all dismissed for uterine fibroids or pelvic inflammatory disease. And then when he re-evaluated them, 40 of them actually had endometriosis. And so that is what I was thinking of when I heard that there. I'm also wondering how long it took for her to finally get that diagnosis, because on average, it takes Black women longer to get, especially in the USA, I should say, to get that in North America, to get that diagnosis of endometriosis. So I feel like that person hit the nail on the head, starting with the access, because, she's acknowledging that she recognized something was wrong and she was trying to get help. But then you get that barrier, that access to care barrier, right? I mean, if no one believes you, then what do you do? And then even when you get your diagnosis, and you're always battling with the doctors who might downplay your pain, so you might not get as strong a medication as maybe a non-Hispanic white woman might get. And then again, when you think about the chronic pain, that is not dealing with chronic pain, but now we are also in a community, in a culture, in a society where Black women are supposed to deal with pain. We're supposed to be accustomed to pain. Pain is supposed to be our birthright, right? So where you complaining about it? So I feel like that quote is very was that the first quote they had there too?
Right on top. And then I wanted to bring the two. So you mentioned several things that was encapsulated in another quote. So and you said this at the beginning, said when I had my follow-up with the doctor, I was told that at the time this is a white woman's disease, and they didn't know how to care for a Black woman. I'm like, wait a minute, she a woman, really?
Yep, that is, and that's.
But we don't feel pain the same way, and that right. There's all these other ideas, and what's fascinating to me is how the stigma, the downplaying, the denial of pain related to endometriosis is very similar to what a woman, a Black pregnant woman experiences who may be at the beginning of preeclampsia, right? And feeling sick and feeling tired, right? I remember saying to my doctor, like, when I talk, I feel like I'm running out of breath. And I would record, I was sending, voice notes to a friend of mine because we would never be able to catch each other at the same time. So we were always doing voice notes. And she said to me, she's like, you're not breathing properly. Like, why are you, listen to yourself? And I wasn't aware of it until she said it, because you kind of get used to this, right? Even my husband, he didn't pick it up, right? So I tell the doctor, and they're like, well, that's sometimes normal pregnancy. The baby's getting bigger. And I'm like, yeah, but this is my third pregnancy. And I don't remember feeling this exhausted or out of breath. So just the comebacks of basically saying what you're going through is not urgent. It's not real. It's in your head. You can push through it. You got this. You're a Black woman. You're going to be fine. Right.
Yep.
And then only until the very end, where your blood pressure is through the roof, you're not able to see properly, you're dizzy, like all the, the symptoms of extreme preeclampsia or HELLPS starts to take place right before you can die. That's when they want to say, you know what I mean? Like you literally have like an hour or two right before, and that's when they start to get into motion.
Right.
And it's like listening to what you're saying. I remember hearing those things, right? And so it's just interesting how across the lifespan of your reproductive life, you are being told that any pain that you feel is normal. Any divergent experience that you think you're having is actually not. It's just, it's
right
in your head. And or they will say, well, there's nothing that we can really do. You just have to kind of push through it, or lay down, or don't take in so much stress, or all these things that have nothing to do with the systems of barriers that are set before us. And like you said, like who's advocating for us? And I always say this: you cannot advocate for yourself when you are feeling sick.
Right.
It's an impossible ask. It's unfair to tell a patient when they're sick, make sure you self-advocate. It's something that is just it feels unjust, right?
Yeah, it is.
So to me, it's like, when should advocacy begin? Because by the time the pain happens, you're not in a position to do that for yourself. And even the people who love you may be in panic as they're watching you deal with something so severe, right? And so should we start to talk to our children about, pain related to menstruation or anything like that when they start their period, or right before they start their period? When would you have wanted to learn about endometriosis? Was it the time that when you realized, whoa, this pain is severe, I can't think properly, I can't focus? When would have been, ideal?
Good question. I think before I started menstruating. I think just having the basics, because it's coming, right? And what I'm seeing now in terms of research is that on average, girls are starting to menstruate earlier, right? I got my period around 10, 11. I think more and more people are getting it around 8, 9 now. And so, sorry, because I know you said your daughter.
Iris, my daughter is 8, and she has breast buds. I believe she's gonna have her menstruation probably 9, honestly. And I'm so petrified, but
I don't know.
So this is the thing. There are resources, so you can buy the books. I don't have any exact names now, but I know that there are textbooks and resources online specifically to help parents navigate talking about menstruation and body changes with their their, I guess, preteen, even before they all start menstruating. But I do think so that, first of all, I think before they see the shock of the blood, because I know for some people
that had me, honey. It was I remember to this day where I was in right before we went to church. It was literally.
Oh goodness, that's a lot.
Yeah, exactly.
Hey, you're muted.
You're muted. You're muted.
We missed the punchline. Tell us what happened after you got to church.
I said it was right. It was on a Sunday morning. Nobody said anything to me. I'm like, Mom.
Exactly.
Like it's blood in my veins. Like, and she still made me go to church. So it was so uncomfortable. And I remember this guy, how kids are. He used to annoy me anyway, but then it was extra that Sunday, right? And so I was so self-conscious. It was just, I remember that today, and I think I was like in 5th grade. I remember where I was the morning of, like, I remember that moment.
Exactly. And me too, right? I remember mine too. So that's why I said before that happens, but I knew it was coming. So I because I've been reading and I was excited. And again, I had an older sister, so I saw her going through it. But for people that don't have that, right? When they see that blood, they think, oh my God, I'm dying, right? And that already starts a cycle of fear and potential shame. So that's why I'm saying do it, like, get them mentally ready for it, right? So this is what tends to happen. This is the cycle. These are the items that you use, in order to manage it. So like, the pads, the tampons, whatever, you feel comfortable talking to your child about at that point in time, but let them know that they are tools. Let them know that they can come to you to talk to you about it, about, how they feel about it. And I think typically, if they're going to, usually you have it around the same time of people like your peers in school. So there might be conversations in school. So you don't want them to be getting wrong information from their peers in schools who might have done their own research and might have parents that are not talking to them. So you want to make sure that they're fully informed about what this means for them as an individual. And then you can have the conversation about, and then there are these conditions that are associated with menstruation that can cause pain. So if you're feeling something that is like more than, if you take a Tylenol or Advil and you're still in pain, please let me know, because that might be something that we might have to discuss further, right? Not to scare them, but just so they know that your pain is valid. And I want you to feel like I'm not going to dismiss your pain, because I think that's another thing where you talk about that discomfort and that pain and parents are like, oh, that's normal. But if you're unable to take like a over-the-counter pill and it not address that pain, that is not normal. That is one thing we need to get out there.
Exactly.
That is a great tip, Julia, I think, to help alert parents about like what to look for if they might suspect endometriosis, is like if it's not resolved with that kind of, regular over the counter, that should kind of help to subside it for some time. So I'm glad you mentioned that. And I had 2 things, and I'm gonna shut up. I'm gonna let Rochelle kind of finish it up. I was so I'm a part of a mega church here in Atlanta, but it really feels really homey because of how you get to know people. But I was thinking, so I say that to say that in our church we do have a healthcare ministry, and we have a huge children's ministry. And when you said that, I was like, well, I'm a part of the children's ministry and the healthcare ministry, and I wonder if we can partner to really talk about children's, like this process for girls, because you cannot now rely, well, you couldn't really rely on certain school systems, because in the South, you can't even mention certain words when it comes to like reproductive health. You can't say condoms in some places. You can't, it's really strict, and only abstinence. And so I think parents have to also be aware of, and these are kind of things I think we want to put out there. You can't rely exclusively on the school systems to educate your children about reproductive health and kind of the things that they're going to be experiencing around this topic, right? And so I'll finish up with one quote where it says, I was given a lot of those drugs. Nobody talked to me about side effects. I was not given the opportunity to make a fully informed patient decision, because they were the doctors, and I just believed what they told me. Nobody told me I would become suicidal. Nobody told me my hair would fall out. Nobody told me that I would have depth perception issues. Nobody told me any of those things. It was just, here, take that medication. Then after the medicines weren't working, it was like, oh, we don't know what to do for you. So,
Very common, unfortunately. So I want to say two things. Oh, go ahead, doctor. Yeah, go ahead.
No. Go ahead.
I will say that my organization back home, we do a lot of church ministry. Like so many churches back home in Barbados, they reach out and ask us to come and talk about the conditions and what to expect. So I'm always happy because again, the church is the community. Church is the community for a lot of people. That's a lot of the formative learning. That's the family. So of course, whenever I would be happy to set that up.
absolutely.
But no, no problem. But yeah, no, the side effects are a major issue within the endometriosis community, unfortunately. I always say treating and like managing endometriosis is like if you're between a rock and a hard place. It's always trial and error. What might work for me might not work for you, but it's always important for the doctor and patient to have that bi-directional, like communicative relationship. Because I need to be able to tell you this isn't working, but you also need to listen to me to say, okay, so if this isn't working, maybe this is something else. But you need to be able to provide the patient with options.
Absolutely.
And some doctors do it. I don't think as many do it as should. And so that's why I'm always a big proponent in if you can get a second opinion or a third opinion, do it because it's your body and it's your health at the end of the day. So I want you to take ownership of that for yourself as well. Yeah.
Excellent. Julia, we have to do a part 2 because there's so much to cover. I mean, I'm thinking about, I have a 15-year-old son and I send him in CVS all the time. Mommy needs pads. Mommy needs listen. I don't want his girlfriend to be the first one letting him know how to help a woman when she's
yes.
I remember when I first sent my husband back then, my boyfriend, he was like, what are you? I'm like, yeah, can you go in the store for me? I don't feel good.
Right.
I don't want to leave the house. Like, can you make a run and get my pet?
And it's okay for you to do that. Like, to me, that's a compassionate, partner, right?
Yeah.
I mean,
my husband doesn't even blink anymore. He's just like,
I remember how embarrassed he was, and he's like, Mommy, really, why? And I'm like, dude, it's okay. It's just pads. Like, it's not, I'm alive and I'm well. Praise God. Like, go get my pads, please. So it's just thinking about that too, like how to get the family involved into destigmatizing this, right? Like when your family member is on their period, how do we support each other and not shame one another for, even the week before, the week after, there's different things that happen to the mind, to the body, the tenderness of the breast, all types of things that happen. For me, it was migraines and cramping, but the migraines are still severe, right? And so it's hard to get treated for migraines when a lot of the treatment is hormonal, and then that hormonal treatment then triggers something else with your menstruation cycle. So it's like
I call endometriosis and anything, I call it the migraine of the uterus, right? It's I just feel like it's that pain that it's hidden, and people have to believe you got it. It's happening. You need the lights off, and you don't need additional stimulus. Like I think that is.
But now, because of all the research on migraines, when I tell people I'm having episodes of migraines, people automatically at work.
They know.
Like, Rochelle, why are you even online? Like, go lay down, right? And so I think it's about talking about this. Obviously, we got to keep talking about it, but also bringing people in to support. What are the actions that you need to do to be a supportive partner, a supportive child, a supportive sibling? When their sister, gets her period, what do my boys need to be ready to do for her?
Right.
And so the support systems and listening to one another, believing one another, like some of these changes we can make like tonight, right? Like if somebody says, I'm in pain for this reason, we can believe them. You don't need to wait on a policy or legislation, to be supportive, because yes, we need to do that too. And Julia is all about that, right? Like all the levels we are at.
All the levels.
Right?
Yes.
And because providers have their own barriers, right? Sometimes they don't give you options because they're not supposed to, or they're not allowed to because of the business system, right?
Mm.
And so we cannot rely on the medical and the health system to solve this issue of stigma, right? Of course, they need to deal with it clinically, but in terms of socially and providing that support, that's a community thing, right?
Yes.
And so my hope is that organizations like yours, the work that Rasheeta is going to do with her church, I love it, right? All these, the things that community people are doing, leaders are doing, I think will make it, it won't be easier, right? But I think it will be with more support for the generations coming up, because we're always thinking about that. Like, how do we do better for the ones that are right after us or what's coming behind us?
Exactly.
So thank you, Julia. Rasheeta, any hope, or Julia, what's your hope when it comes to this issue? Or,
I'm gonna let Julia
okay.
talk about the hope today.
I thank you for providing this platform. I think the hope is that, we have, again, more people willing to have these conversations like in these spaces. So I'm excited to potentially be able to speak with your church members and then that again starts that cycle of increased education within the community, reduce stigma. Oh girl, I got my period too, and it's like not stigmatized. You're just talking about it like if you had like a sniffle, or like if your allergies are acting up or something like that, like really destigmatize it to the point that it's normal to talk about your period, because then when you normalize talking about your period, then you can say, oh wait, no, something is wrong.
Right.
And you can identify that something is wrong. So especially having that within the community. And then, I think, yes, we have the biomedical model of health, which it serves its purpose in a sense, but I think we need to obviously extend that, because we are whole beings. And so that psychosocial aspect is really integral as well, because again, when you leave that doctor's office, or even when you're in that doctor's office, you are not there, separate from your mental health and your emotional well-being, right? Like all of that comes with you and all of that leaves with you. So I think it's important. And I know doctors have so much pressure. I know the system is under-resourced. So I think but I still think it's really important for them to also approach these types of matters with a level of empathy, particularly when we talk about the whole concept of fertility and adverse pregnancy outcomes, and like how sensitive those topics can be, and recognizing that they're dealing with a whole person and not just like this patient that is just like organs put together in front of them, but this person that has like these real expectations that have been placed on them, and helping them navigate through these difficult and stigmatized events. Because again, we still need to remove that stigma on adverse pregnancy loss. We still need to remove that stigma on infertility. We will get there, but it will take some time, because we believe that pregnancy and childbirth is a beautiful thing, but it's something that we also need to recognize it's not that easy to come by. And even for those people who do have the children, they still need help, right? Everyone still needs help. So I think this comes into bringing back the village. So I'm coming back to bringing back the village, and making sure that the village is central to us, and bringing the medical providers into that village with us as well. So I think that's my hope, because I think that's where
your hope is amazing.
I love it.
I really don't need to add much to that at all. I will say that I agree with Rochelle that we need maybe even a part 2 and 3. I would love for us to think about bringing in not only you, Julie, but also maybe some partners or men, other kind of maybe a little bit more of a panel to talk about like how we stigmatize and really think about this as a community. So I would love us to consider that. But then also, we're trying to whet your appetite for some other things that I thought about too, menstruation and kind of like the holistic aspect of us, but also like the hygiene portions of it. And I guess I'm thinking about like the young people, as we were talking about how do we introduce the concept and really talk to them about how to get prepared for this, and just a little bit more of a holistic view around that, where it's menstruation, but also like hygiene. Like I just think about how my mom taught me about how do you dispose of, things where it's not offensive, especially if you're at someone else's house, and all of those types of things. Like how do we, because obviously it's blood and you want to make sure that you dispose of it properly. So like how we could talk about how we were taught, but then what would be the most appropriate ways dealing with a bodily fluid. And then I also just wanted to really bring up, because we did talk about healthcare providers in this pretty extensively. And I was on a call prior to this, and one of the things that was a problem was that we had a mom who was trying to get a special formula through WIC, and WIC kept denying it. And so it was getting a special formula, not in powder form, but in the ready-made form. And I bring this up because they were like, well, we don't cover that. We don't cover that. So we talked through it. And ultimately we said, if the provider uses the codes that are the social codes, not only the medical issue, but they can provide the person is unhoused, the person is homeless, inability to prepare the formula correctly, that there are social codes that would then permit WIC to say, okay, this is a social issue that would allow for us to fund it. So I think to your point about us being holistic in our approach, even in the healthcare sector, is important to meeting the needs of the person. So.
Yeah.
Excellent. Well, thank y'all for listening. We're saying silence no more. And we want folks to feel supported during, these times, and people you live with endometriosis. It's not something that necessarily disappears.
It does
and so there's so many myths too that we'll have to break down. Because I think there's misinformation, there's old wives' tale, there's all kinds of other tales that I think reproduce harm. And so we want to spend some time getting into the nitty-gritties of those things. But we're just so grateful that you joined us today, Julia. And all the best with your dissertation. It's going to be amazing. And we look forward to you coming back and sharing more insights, and bring friends.
Yes. Anytime. Happy to be here. Thank you for having me. Anytime you need me, just call.
Awesome. So thanks everyone for joining us. We cannot wait to see you again at our next podcast. So thank you so much, and we will see you later.
Thank you.